Hello, welcome to everyone. Welcome to our opening show, open evening of this month. I'm joined by Marna Marks, our marketing manager, who has been the driving force behind this. And I'm also joined by Sarah Templeman, our nurse manager, who's going to be answering any questions that you may have in the background while the session is going on. The session, the purpose of the session is to explain to you what we have on offer and tell you about a bit more about us and how we work and how we can help you. So before we start, a little bit about housekeeping points with, sorry. Your microphones and cameras should be turned off. There is a little question mark icon at the bottom of your screen, and you can use this to ask any questions right from now till the end of the session, and we'll be answering these questions as we go along and continue to do so till we've answered to all the questions that have been put forth. We would love you to give us feedback, any comments, any feedback regarding how we can help you better through this session. To start with a bit of history about our center, this was founded as the Essex Fertility Center back in 1989. So this July we completed 34 years of functioning and have over 7,000 babies to our credit. All the procedures that we need to do, starting from stimulation, testing, egg collection, all the way to embryo transfer, and even pregnancy scans are performed under one roof. And this is a state-of-the-art, purpose-built clinic for fertility services only. And the range of services are those specific to fertility treatments. So we can start right from assessment of fertility, guide you as to how best you can deal with your fertility requirements, and help you through the treatments up until you get to your target, that is pregnancy. We have an egg bank and a sperm bank, and egg donation may be advised to women for a variety of reasons, including age and earlier menopause. Some of you may have had chemotherapy or radiotherapy in the past for cancer treatment. Some may have had IVF treatment in the past and found that the egg quality is poor and that is not able to sustain or help in creation of embryos and therefore pregnancy. And therefore, you may have been advised to consider this option. Single men and same-sex male couples may also find this option the only option in conjunction with surrogacy in order to complete their family. Similarly, sperm donation may be advised to those couples where the man is unable to produce sperm. This may be either on account of underlying genetic condition, or it may be because of a past cancer treatment, such as chemotherapy or radiotherapy. Single ladies and same-sex female couples may also consider donor sperm in order to complete their family. In order to start the fertility journey, we need to understand where you are at the beginning. So fertility assessment consists of 2 visits over 2 weeks. So first visit, we would do your blood test, and second visit, you would come for, these 2 visits are the in-person visits. So in the second visit, we would do a scan to look at the uterus, look at the cavity of the uterus, make sure it's normal. We can do a test called HyCoSy, which helps us to understand whether the tubes are working well. For men, we can do a semen test on the same day as the blood test so that it's ready when you come back for your assessment. You can also opt for a female mini fertility assessment, which consists of blood tests just for AMH, followed by a scan to check the antral follicle count and the 3D scan of the uterus. Unlike men who continue to produce sperm throughout their lives, women are born with whatever stock of eggs they're ever going to have. And as the age advances, the stock of eggs diminishes or depletes. And when the egg reserve is still good, they would have a normal or high normal AMH. And this corresponds to a high or normal antral follicle count. If you look at this first image on the left, this is the image of an ovary, which shows little bubbles. Now, these bubbles are antral follicles, which are the follicles in the ovary, which are in a position where they can start growing, and one of these would release an egg in a natural cycle. As the egg reserve depletes, the number of these antral follicles also goes down, like it shows in this image, where there's only a couple bubbles that you can see. Now, it's not just about numbers. What is even more concerning is as the number of eggs or the egg reserve goes down, the proportion of eggs that are genetically normal also goes down significantly. So in this image, you can see the green dots refer to the genetically normal eggs, while the red dots are the genetically abnormal eggs. And you can see a fair number of both in this, where the AMH is normal or high. Whereas as the image goes down, you see lesser number of eggs. The proportion is much lower for those eggs which are genetically normal. So after this initial assessment, or you can actually even go straight for consultation, which is in two parts. Two parts that are in person, but this is preceded by an online portion where through our online forum called Fertility Consents Online, you log in, put in your details, complete the questionnaire so that we can understand your history and your clinical details. You upload your passports for identity purposes as well, and other investigations that you may have had with your GP, your gynecologist or urologist or so on. Following this, you would come in person to the clinic once, where a nurse would do observations for both partners, and we would do blood tests. For the female, we would do AMH and thyroid functions. Thyroid because it's an important hormone which has an impact on the reproductive health. We would also check the BMI because we are a standalone clinic and we are concerned about the safety, and it's important to stick to a BMI under 34 for sedation. So we only do IVF for women who have a BMI either at or below the 34 mark. At the pre-assessment, in addition to the blood test for the woman, we can do the semen assessment as well. And then you would go home and return for a consultation, which is online through Microsoft Teams, and a consultant would, on a one-to-one basis, spend time with you and explain what the assessment results have been and what the recommended treatment protocol would be, and how you can optimize your treatments and get a pregnancy in the best way possible. We would encourage you to use a Salve app through which we find our patients are able to make the most of the treatment in a very controlled manner. It has a medication manager which reminds you of the medications that you should take. It also gives you robust medical information, which you can refer to in case you have any questions or any side effects which you're not sure of are connected to the medications that you're taking. It will remind you of the appointments, and it also gives you the option of being able to message us and get answers to your questions in a secure manner. While you're aiming to get pregnant, it is important to take the right steps in order to be at the best fitness in order to be fertile, not just in mind, but body as well. So that can be through exercise, which is not just important to optimize your BMI, but also is a great stress buster. A healthy diet, a healthy balanced diet also goes a long way in getting the fitness that you need. Once the consultation is done, the next step is an appointment which is called as treatment information appointment. Again, this is remote, and that works well for couples who are who may find it difficult to travel and then find parking and then spend more time on the actual things that need to be done before the treatment can start. So at this time, it's extremely important for both partners to attend because this is the time when a nurse would explain how to administer the daily injections that you need to take for the IVF, explain how the process of IVF works, answer any questions that you may have still have that haven't been answered so far, complete the consent form, and also help you with understanding and coming to terms with any other issues that you may have. The next step would be a special scan, which is called as 3D saline infusion sonogram. So the cavity of the uterus is a collapsed cavity where the front and back walls are juxtaposed to each other. So if there are any masses growing from the inside skin of the uterus, like you can see in this image, this is called as endometrial polyp, which is a small growth, a fleshy growth arising from the inside of the skin of the uterus. And this can be picked up very effectively by injecting saline into the cavity of the uterus, which can demarcate as to whether the cavity, this is how it should be. But when we see a growth arising from any of the walls, we can find it out and we can do the needful through a operative procedure called as hysteroscopy. And before you can have the IVF in order to have the best outcome and prevent any chances of miscarriage from the underlying abnormalities. So in case there are any polyps or any fibroids which may actually impact the chances of pregnancy through IVF, those can be done before the IVF itself. The next step would be screening of both partners through, screening includes infectious screening such as HIV, hepatitis B, C, chlamydia. For the female partner who's going to carry the pregnancy, we do a AMH rubella test to make sure they have the requisite immunity to fight rubella. And we also check the full blood count to make sure they are in a healthy state to be able to carry the pregnancy. As per the HFEA regulations, these blood tests need to be within 3 months of the day of egg collection and can be carried out either at our clinic or through a UCAS accredited lab. Starting with the different treatments, there are so many, and it won't be possible for me to talk about each and every one of them, but I'll try to talk about the major ones. And the simplest fertility treatment is intrauterine insemination, or IUI in short, where we inject the healthiest available sperm and into the womb cavity at the time that we expect the egg to come along, so that the egg and sperm can meet in the tubes of the woman and help maximize the chances of pregnancy. And this would benefit most those heterosexual couples who have psychosexual problems and therefore aren't able to have intercourse, either because of pain or because of male impotence or severe premature ejaculation. Similarly, this can be helpful for women, single women who are using donor sperm, or same-sex female couples who are using donor sperm. With the information technology, with the social media, more and more people are becoming aware of the biological clock and of the need to preserve fertility for future. It is difficult to find the right time and find the right partner to have a baby with. And therefore, if you're concerned that biological clock is ticking, you can consider freezing eggs. And these eggs can be collected through stimulation and then frozen in liquid nitrogen with good success rate. Previously, the HFEA limitation was only allowed egg freezing for 10 years, but with the limitation being now to be for 55 years, I think a wider section of women can find it beneficial so that they can preserve their fertility for future. This may be either for social reasons or because they may have a history of early menopause in the family, or may have been diagnosed to have cancer and want to collect and freeze eggs before the cancer treatment for best chances of success in future. Surrogacy is when someone agrees to become pregnant and have a baby for another couple. And here, therefore, there are two parties. One is a surrogate and the other party is the intended parents. And often this is the only option for women unable to carry a baby to term, either because they don't have a uterus, they may be born without a uterus, or they may have undergone hysterectomy for a medical reason. It is also the only option for same-sex male couples, and it may be of two types: full or host surrogacy and partial or straight surrogacy. With the Law Commission making changes, I think things are going in the right direction, and we hope for several changes that would make the law more conducive to the couples in the present day. So just to give you a overview of how this flow is, it would start with a consultation. We would do screening tests, a treatment information appointment where we would complete the consents and just help you with getting your questions answered, getting ready for the upcoming IVF cycle. And then when your period comes, we would do a scan, start you on the medications to stimulate the ovaries, which culminates with the egg collection. Once we have the eggs and the sperm, we create the embryos. These are cultured till the right stage and then transferred. Surplus embryos may be frozen. And about 2 weeks after the egg collection, just over 2 weeks after the egg collection, is when we find out the treatment outcome. So how does it start? When does it start? Once you've had the TIA, we've done all the consent forms and you're all set. The infection screen has been done for both partners. You're now waiting for your period. When you have your period, you let us know and we'll ask you to come in for a scan on either second or third day of the cycle. And this scan, we would check your ovaries, make sure everything's okay, and start giving you the first drug. Now, this drug is going to help stimulate the ovaries and encourage the antral follicles, which are present within the ovaries, to start growing. And this drug continues all the way up until you're ready for egg collection. all the symptoms that you have in a natural cycle, in a natural menstrual cycle, may be exaggerated, and these drugs may cause headaches, mood swings, breast tenderness, bloating. Some women may have a little bit of symptoms, others may have a lot of symptoms, and yet others may have no symptoms at all. So it's quite variable as to what your experience would be. And as you go along, we would be scanning to keep an eye on how many follicles are growing, how fast they're growing, what are the sizes, and mapping all that. That would help us to decide two things. The first is the beginning of the second drug, which is called as cetrotide. This is a drug which is usually started on the 5th day of stimulation, but it may be either slightly earlier or slightly later, depending on how your ovaries are responding to the stimulation. And this is designed to stop you from ovulating prematurely while the follicles are still growing and while the endometrium, which is the lining of the uterus, is still growing. Each scan is followed by a consultation with a nurse who would make sure you understand exactly what's happening, answer any questions that you may have, teach you or remind you how the drugs are taken, and basically do any troubleshooting that may be required. The final scan, which often takes between 9 to 12 days or sometimes 14 days of stimulation. That's when you will reach the point where after scan, we will tell you that you're now ready for the next stage, which is egg collection. So the night that you reach that point, you would have a trigger injection, which is often HCG trigger. HCG or pregnancy hormone is the most common trigger injection, which helps the eggs and the follicles to be ready for collection. So egg collection is done 36 hours after the trigger. And for this, you would be admitted to the recovery bay approximately half an hour before the scheduled time of egg collection. We would do baseline observations. The husband or male partner would be providing the semen sample, which would be prepared as parallelly while the egg collection procedure is being done. The woman is given sedation. We don't give a full general anesthetic. We do it under sedation so you're comfortable, but we aren't able to give you a full general anesthetic. The procedure normally takes between 30 and 40 minutes, depending on how many follicles there are to collect. And this is followed by recovery, and you would be able to go back home once you've recovered completely, and this may take anywhere between 1.5 to 2 hours. So the short antagonist protocol, which is the most common protocol being used for IVF currently, you would have a scan on day 2 or day 3, which is when we start the daily injections. You have the second scan after 4 or 5 days, and a third scan, which would help us judge when you would be ready for trigger. So once you're ready, you have the HCG injection, and 36 hours later, you have the egg collection. The same night as egg collection, you would start with progesterone medication, and either 3 or 5 days later, you have embryo transfer, and this depends on how many embryos you have. About 12 days after the embryo transfer, we would advise you to have pregnancy test, so roughly about 16 days after egg collection. The same day as your egg collection, we would create embryos, and there are a few different techniques of making embryos. The commonest or the simplest one is IVF, where we would, in simple terms, it's just mixing eggs and sperm together and allowing them to, self-select and be able to fertilize the egg in a more natural manner. Where we are concerned about the quality of the sperm, or if there has been a previous IVF cycle where a lower percentage of embryos formed, we may advise you to have ICSI, where a sperm is injected into each of the eggs in order to create embryos. And PICSI is a special type of ICSI where we use a special assay to pick out the sperms which are mature to have a better outcome. In order to decide whether we're doing IVF or ICSI, we use the 1999 WHO criteria, which is 20 million of sperms per ml. So if you have a count which is less than that, we would advise ICSI. Similarly, the minimum motility required would be 50%. And the percentage of sperms with a normal structure should be 15% or more, and the HbA score, or the hyaluron binding assay score, should be more than 65%, which means that 65% of the sperm should be mature in order for IVF to be recommended. So if these parameters are not met, we would advise you to have ICSI. ICSI would also be advised if we are surgically retrieving your sperm, or if you have anti-sperm antibodies, meaning the MAR test is positive, or, as I mentioned before, if you've had a previous IVF cycle where the number of embryos formed was less than expected, we would advise you to have ICSI. So this is a video of ICSI, and where you can see that this is a thin needle, which is the size of a hair. And these are sperm. You can see some of the sperms are moving. We just saw one move across. And the embryologist is going to find a sperm, possibly this one. And it starts with flicking the tail, which stops it from moving too fast. So that's what is being done. He or she has flicked the tail, which stops it from moving, and it's now sucked into this tube, or pipette as it's called. And now we go close to an egg. So this is the egg, this is the shell of the egg, and we inject the sperm at perpendicular to the polar body, as it's called. So we get it right to the tip of the pipette before we go into the egg. And suck the cytoplasm, or the cell fluid, of the egg to break it down a little so the sperm can do its job. And this is the sperm. You can see it going into. And there it is. And we come out. So that's the sperm here. And the egg is now returned to the incubator, and this egg would be examined the following day to see if it's been fertilized. So PICSI is a special type of ICSI where when we look at sperm, not all sperms which are moving and have a normal structure may be mature, which is why there is a special assay that is done, which is called as HbA, or hyaluron binding assay. The idea is before sperms can get attached to before sperms can fertilize an egg, they need to get attached to the shell of the egg, and only then they can make way through the shell and into the egg and fertilize the egg. And so those sperms which are immature won't be able to attach themselves to the egg, and therefore HbA assay would possibly pick out those men who have a lesser percentage of sperms which are mature, and therefore would be at a higher risk of being able to create as many embryos as they should normally. So these couples where the HbA assay shows a lower percentage of sperms which are mature and therefore have a lower potential of fertilizing the egg, would be recommended PICSI. So using this assay, the sperms which are normal or mature can be selected preferably and used for injecting into the egg. So the eggs, once we do either IVF or PICSI or ICSI, and these eggs are then examined the following morning, which is when an embryo should look like this. So this is the shell of the egg. There are some cells still attached. We call them cubulus cells, and this is the embryo. And you see two tiny structures which are called as pronuclei. So this refers to the genetic material one belonging to the egg and the other to the sperm. So we call it a 2PN stage, or 2 pronuclear stage. That's a normal embryo. We should be seeing 2 of these. If we see 3, that means it's an abnormal embryo, and we can't use those for transfer. And once the embryo is formed, it very quickly starts dividing 2, then 4, then 6, and so on. So a typical day 3 embryo can have anywhere between 6 to 9, 10 cells. The ideal cell number is, of course, 8. You can see one embryo here showing 1, 2, 3, 4, 5, and 6 cells. Here, I think it has 8 cells. 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, okay. So we look at these cells, we look at how equal these cells are, and we see if there are any small portions which have leaked out while the cells are dividing, and that's how these are graded. By the 4th day of embryo's life, it becomes a tight ball of cells, and by the 5th day, it should become like this. This is a blastocyst where you can see the 2 groups of cells. One remains a tight ball of cells, and this will eventually form the baby, and the rest of the cells are aligned in a single layer on the inside of the shell, and these are called trophectoderm. This is called inner cell mass. These form the baby side of placenta, and this forms the baby itself. And there is fluid in between these 2 groups of cells. The shell by now thins out, and it starts hatching out. You can see a little small portion of the embryo which is starting to hatch out. It would eventually hatch out completely while the shell remains, and this gets implanted and starts a pregnancy. Sometimes it can split into 2 as well and give twins. Right, so the day of embryo transfer depends on how many eggs and how many embryos are formed. If the number of embryos is a small number, there is no selection required. So the embryo transfer in this case would be done by 2nd or 3rd day after the egg collection. However, if the number of embryos is 3 or more, a good number of embryos are formed, we would want to find out which of those has the highest potential of giving you a pregnancy. And the easiest way to do that is to grow them to the stage of blastocyst, which is 5 or 6 days after the egg collection. The latest day of embryo transfer is the 5th day after egg collection. So if you're having a fresh transfer, this would be done on the 5th day, and the best embryo would be transferred. Any other embryos that are of good quality can be frozen for later use. When we do the embryo transfer, we would be showing you the embryo. We would give you a picture of the embryo to take away with you and give you information regarding your cycle as well. You have the option of using embryo glue, which is a special transfer medium which mimics the conditions present in the female uterus in order to maximize your chances of implantation of embryo. This is the add-on treatment, and you may decide to opt in or opt out. We do embryo transfers all 7 days of the week, and irrespective of whether it's a bank holiday, weekend, we do it every single day of the year. And we would do transfer on a day that is best for you and for you to be able to get pregnant. From the beginning of this year, we are now able to offer the option of pre-implantation genetic testing. More and more clinics have now started doing PGTA, where we do a biopsy of the embryo once it reaches the stage of blastocyst to see whether it's normal or not. Because often, even though the embryo may be a top quality embryo, it doesn't give you a pregnancy because the embryo is not normal. And so by doing the testing of embryos and selectively only transferring those which are normal, it prevents the heartache of having a negative outcome or having a miscarriage sometimes. If you have a genetic condition running in your family and you're concerned that your baby may be affected from it, such as cystic fibrosis or BRCA gene or Huntington's disease, we could test the embryos and only selectively transfer those embryos which are free of the disease, so that your chances, your child's chances of having this disease are minimal. There might be structural arrangements present within the cells of the parents, one or both parents. And again, this can have an impact on the chances of pregnancy. It may cause recurrent miscarriages. And in those couples where this is the cause, we can help you get pregnant using your own eggs and sperm, so that you don't have repeated miscarriage. We have IVF witness system in our lab where each patient who's coming through for any procedure are given an ID, and the sperms, eggs, embryos are electronically tagged. And this enables or ensures traceability of all lab procedure and prevents human errors in creating embryos. So we can ensure that the right egg and right sperm are used to create the embryo, and the right embryo is going into the right patient. Once you've had the embryo transfer and hopefully have a positive pregnancy test, we would then ask you to come back in 3 more weeks, by which time you would be 7 weeks pregnant, which is when we see a little gestational sac in your uterus, and we can see a baby and a little yolk sac, and we can offer you another scan up until 11 weeks and 6 days, in case you have any bleeding or simply need reassurance that all is going well. You can fund your IVF cycles. We have contracts with NHS PCTs such as Mid and South Essex ICBs, and these areas would come in that. Mid Essex, Castle Point and Rochford, Basildon and Brentwood, Thurrock and Southend. We also have a contract with North Central London ICBs, including the areas of Barnet, Camden, Enfield, Haringey and Islington. In case you want to think of other options to help fund your IVF treatment, you can find out more about programs such as egg sharing, where you share half the eggs that you produce. So you keep half the eggs and half eggs are shared with another couple, and that can help you fund your treatment cycle. Similarly, you can do sperm share, you can do egg freeze and share as well. We have a very transparent way, we have a complete transparency about the charges for the various treatments that we offer at Herts and Essex. They're present on your website, on our website. A typical cycle of IUI would cost about 1,150. IVF would cost 3,800. ICSI is 5,000. Donor eggs could cost between 10,000 and 12,000, depending on which kind of donors you're using. It could be either an altruistic donor or egg sharing cycle. Donor sperm typically costs 1,000. A fertility assessment, depending on whether it's a couple one-stop where we do all the tests and the scan and high COSI, or mini fertility where we would only do AFC and AMH and scan. So these assessments may range anywhere between 210 to 690 pounds. Egg freezing cycle per cycle would cost you approximately 3,500. None of these include the testing before the treatment or the medications. We have Access Fertility as our partner, and who offer different programs such as IVF Unlimited, IVF Refund, and IVF Multicycle that can help you get cost-effective options for getting to the point of possibly having one or more children. And you can have more information about what programs they have on offer on this website, www.accessfertility.com. We at Herts and Essex believe in emotional support and well-being while you're having IVF treatment, and Mana is very active through all our social media platforms in giving positive vibes and supporting patients through their journey. We have Alex Ballard, who's a UK registered dietitian who can be approached for dietary advice. She gives a one-on-one consultation. She's really passionate about nutrition, and you can read her blog posts on Fit for Fertility and get very valuable information as to how you can improve your lifestyle and attain a better BMI. Last but not the least, a few points as to why you should consider Herts Essex. We have over 34 years of experience, a 7-day-a-week laboratory, so that ensures that whatever procedure needs to be done will be done for taking you into account what is best for you rather than doing it at a time that's convenient to us. We have an electronic witnessing system which prevents any errors or mistakes from happening. We have a long track record of over 7,000 babies, and we are passionate about supporting you throughout your treatment, emotionally and psychologically, and making the whole experience as positive as possible. We would really value your feedback, and please do complete the short survey to let us know how we can improve the event. The survey link will be sent in the Q&A chat and also by SMS tomorrow. You can connect with us through any of our social media channels, and you can get an appointment through our landline 01992 7850 60 or through our email address. I'm going to share a link which will give you a virtual tour of our clinic. I'm sorry, because of the way Microsoft Teams works, you won't be able to hear the sound. We will share this link on our Q&A chat so that you can directly view it with the sound in your own leisure. Thank you for your attention. We will post the link of this video and the Q&A session. I hope you've been sending through your questions, and we will continue to answer them till we've answered every single one of them. Thank you so much. Have a great day. Bye-bye.